So this question is asking you the interventions that would decrease the number of mitral valve replacements, right? And it basically narrows down to like two options, like antibiotic treatment for bacterial pharyngitis and echocardiography for mitral valve prolapse. It's pretty obvious answer again, right? But let's look at other options as well. So this option, improved access to drug rehabilitation centers, right? Those would that would be the right answer if you were talking about tricuspid valve replacements or something, because IV drug abuse is associated with tricuspid valve endocarditis because they inject drugs intravenously, right, in the venous system. So this again is out. Then genetic screening program for fibrillin 1 gene mutation, right? This could cause a mitral valve prolapse, but the main cause, again, as we all know, is rheumatic heart disease, right? So again, you can rule that out. Next is childhood vaccination against Corynebacterium diphtheria. That again, is not true because it causes myocarditis and not mitral valve prolapse or mitral stenosis, right? So you can rule that out as well. So what essentially the question is trying to test you is that if the main cause for mitral valve replacements is rheumatic heart disease, which is caused by bacterial pharyngitis in young age, right? So prompt antibiotic treatment for bacterial pharyngitis would essentially, prevent rheumatic heart disease in the first place, right? Whereas the last option, screening echo for anterior valve leaflets, prolapsed anterior valve leaflets, would not actually help with the progression of the disease, would not help prevent the progression of the disease. So what happens is that there's strep throat, then there's rheumatic heart disease, then there is mitral regurgitation, and then there is mitral stenosis, right? So mitral regurgitation happens because of the valve prolapse, and early detection of valve prolapse is not going to actually prevent valve replacements or mitral stenosis, right? So that way you can rule out option E as well.
Thanks for watching. Please give a thumbs up and subscribe for more.